They lost like 7 kilos. Now some people have lost, I had a 67-year-old lady who had arthritis in her knees, terrible arthritis. She could not, I couldn't get her, she was due for a knee operation actually, because she had total knee replacement left and she was about to have it on the right knee. And she actually, she couldn't sleep well, she was aches and pain, she had huge sleeping problems, she had pain in the knee and she couldn't get up out of half crouch position. I put her on the weight loss program just to take the load off her knee. Because that was actually, so I actually, instead of getting her totally locked, I actually put that a little bit further first. But she'd been my patient for ages, so she wasn't too bad. So I put on her, she lost 10 kilos in like 5 weeks, and she was 67 years old. And she did not do any exercise. 10 kilos off your knees, and most of your weight is above from the knee up. I mean, how much weight do you carry from the knee down? You take 10 kilos off your knees, and she had, at the end of it, there was no pain in her knee. She cancelled her operation. Said, my knee feels really good. And she could sleep better because she had her whole endocrine system revitalized. So she got her waist back too, which was really nice. So that was, a 67-year-old lady. And I've had people who have been 70 and over do the program. So age is not a limit, except you can't do it when you're really young. But, from about 15 on, you'll be appropriate, it's appropriate to look at the hormones. Any other questions while we're at it?
Do you do before and after photos?
Yes.
Oh, you don't, do you?
We do. We actually take measurements and we take before and after photos. And it's really for your private viewing. So you can see the difference if you want to see them. So, it's really motivating to see that. So far, actually, what we've changed, because we were taking, from the head down, then we couldn't identify who was who. So now we're taking the full one. If people want, then they can take their photos or whatever. It's just nice to see. Yeah, so it is important to do that. You need to do the side, just like those ones, the side, the front, so you can actually see. You just come in, dress in your gym gear or something, so you take something that's sort of a bit tight.
So what would be the minimum time if someone's in relatively good health and not too many problems, or virtually no problems,
okay,
to get into it?
So if someone is pretty clean, we will always still do a cleansing phase. So the phase 1 we'll do a minimum of 3 weeks. If they have no fungus, bacteria, virus, parasites, we treat them. We do a 3-week cleanse. That just get the gut and liver primed up and make sure the liver is, because the liver is your best fat burning organ. So we make sure the liver is in the best shape possible to go into the phase. So that's like 3 weeks minimum, and then they go into the 4 to 6 weight loss, the HCG Fat Burn program. And then after that, it's actually the phase 3 where you transition. That's a minimum of 3 weeks. And really, ideally, if you say you had 40 kilos to lose and you might lose, say, 15 on the first one, you might want to do that again the second time round. So, but essentially, we coach people through the first cycle so that you know how your body copes in relation to this program. If down the track you want to do it again yourself, then we allow you to go and have the hormones prescribed, and you can actually do it on your own without us supervising, because you've done it already. I will not give people the hormone without us supervising first, because you get into trouble. Okay, so that part I know, because I've seen people in trouble. And most people prefer to be supervised anyway. If you're going to do it properly, you might as well get the right results, from the beginning.
Weekly hormones,
yeah.
During that phase?
During the hormone phase, you come weekly. The other phase, you don't. It just depends on what you need to do. So the weekly monitoring phase on, because I can tell we get so many phone calls and support, isn't it?
Yeah.
That all these challenges come up for you, and you know what happens? If you're a person that comfort eats, suddenly you 500 kilo, 5 kilo, and you can't comfort eat, it brings all your emotional issues to the front. You need the coaching. I can tell you, you all need the coaching, and we give you email and phone support when you need it. Okay, so that it's not very much. But if it's high density, organic, nutritious food, that's all you need. It's a bit like having a mini fast, but you're not really fasting, you're actually eating high quality food, and you can survive on that. But don't forget, you're burning a lot of calories. You're releasing a ton of calories from your abnormal fat, so you're not hungry. Have you had anyone feeling?
I haven't had one patient say they were hungry. I asked everybody, and not one person said they're hungry at all. Just, I've had one patient say that they actually, it was today, they missed food because we've been trying to work out, you know, whether it's a hunger or not, and she's decided that it's not. She's not hungry. She just misses eating the food. We're so used to eating so much food. We're so used to eating so many things. We actually overburden our bodies with so much. We don't need that much.
Thing as well.
Yeah. Exactly. So we get in habits.
You're out socially.
Yeah.
Is it high protein? It's not like, because I did that high protein thing where I could almost eat the dashboard out in front of my car. I was dying, and they were like, no, you never get hungry, you never get hungry. I was starving.
Yeah.
It's not.
I mean, it is there is protein in your diet, and it's a high carb, but you do get you have some carbs as well, and you have vegetables, you have some fruit, but it is 500 calories. But as you're releasing so many calories, as I said, from your fat store, now if you don't have much weight to lose, and you go fine, and then suddenly you get hungry, that's because there's no more abnormal fat stores. You're not burning anymore. You have to stop. Right. So your body goes, I've had enough. Can't lose any more fat. So you will not go anorexic on this program.